you call Atlantis, you'll probably notice the difference between us and other clinics right away. We are very thorough in our consultation process, so we will be asking you questions about your medical history and how your current condition is affecting your life today. As part of your consultation process, we're also going to be sending you for full spinal x-rays so that you can have a good understanding of what's happening internally with you as well. Dr. Burke will review those x-rays with you and he'll be able to give you his best recommendation of care from there. A lot of patients tend to be surprised that we send them for full spinal x-rays, either because they've never gone for x-rays or imaging before, or because no practitioner has really been that thorough with them. So when we do that, we're really able to dig deep into your condition, look at the root cause, and really provide the best tailored solution to your pain and to your condition. A lot of patients come to us really frustrated. They've tried everything before, they've been to other clinics, and really our clinic is kind of their last resort before either going to surgery or taking drugs on a daily basis. So for patients who don't want to do that, we are really a good solution, and spinal decompression can absolutely help with a number of conditions. The most rewarding thing that we get to see is really having patients leave our clinic feeling like themselves again, being able to do things that they didn't think that they'd be able to do again or be able to do at all, like dance at their own wedding, pick up their grandkids, or simple things that we take for granted, like going back to work or hanging out with family and friends. For people who are in a lot of pain daily, these things are really hard for them to do, and we help them get back to life.
So before you come in, my team and I are going to have sat down and talked about your specific goals, your needs, what's bringing you in, and the frustrations that you've been feeling up to this point. So whether it's back pain, whether it's neck pain, sciatica, or bulging discs and stenosis, we know what you're coming in with, so we can cater to your needs. So when you do come in, we're going to have those x-rays already looked at prior to you coming here. I'm going to have analyzed each x-ray image itself. We will get a report from a radiologist, but we consult both of those to really determine what your needs are. I'll put together that care plan based on that. So when you do come in, I'll be explaining the root cause of this problem. We're not just addressing the symptoms, we want to find out the cause. And in most cases, the cause is the disc problem. So ultimately, I'll be explaining that the disc is the cause of the problem. The disc is the spacer between the vertebrae that creates space for those nerves that make you feel the way you do. So as this disc is normal, it's when these discs are working due to proper motion. There is circulation only through movement at the disc level. It's never going to work if it's being locked and compressed. So as it loses fluid and compresses, we're going to start getting these symptoms getting worse and worse. So the cause is the disc as a result of alignment. So really that's what we're going to explain to you and show you in your x-rays where your discs are and which ones are the ones that need specific treatment. So as we get to the treatment, it's our method. It's the back to life method. And what we start with is always the correction of the most important thing, which is the disc and the alignment. So the adjustment, the chiropractic portion of treatment, is to adjust your spine, get the bones moving again, get the pressure off the nerves. That's the most important thing we do. We want to reset your nerves. We want to reset your alignment. From there, we always work on the area involved at the disc level. So that's going to be spinal decompression. Spinal decompression tables are what restore that area. The bones move and pull apart with these specific computerized tables. We're going to punch in a gentle amount of poundage for your spine based on your body weight and what your spine is showing in those x-rays. And as we pull and decompress that disc, it's going to get those disc spaces coming back, fluids come back in, and we're restoring that alignment and disc space again. So what's unique about our tables is we can really target those discs that you have your problem at. So basically, angling your legs, angling your neck, whatever area needs the decompression, the table is unique for that. And true decompression. True decompression is where it works in a process. It's a program that pumps those discs, relaxes them, and gets them working again. So that's going to be for the disc problem. And then we use a class 4 laser. So we have one of the strongest lasers on the market. Laser is a penetrating, healing light, and it goes into the tissue, and it helps improve circulation, blood flow, breaking up inflammation, and getting things moving again with better circulation and healing the cartilage. And lastly, we'll give you supportive devices. So on the lower spine, if it's a sciatica problem, for example, we would have a special customized belt that we wrap on that area with ice packs. You take those with you, you leave here, and that's going to give you support during your day so you don't go and compress your spine again. In the neck area, we have neck orthotics, which restore shape in the neck. So ultimately, there's a correction of the posture and ultimately long-term correction. And beyond that, that's what most patients see, that the long-term results are there. And when they choose to maintain that, when we go past these programs and we take